In this video, you will learn how to create consent forms. Hi, my name is Liz. Don't forget to hit the like button and subscribe to my channel so you get notifications of future content. Let's talk about consent forms. So, building a consent form for your private medical practice involves several important considerations. While I can provide you with a general framework, please note that it is crucial to consult with legal professionals or experts in your jurisdiction to ensure compliance with local regulations. Here's a step-by-step guide to help you. All right. So the first thing we're going to do is create the header of the document. You want to make sure to include your medical practice's name, address, contact details, and the date of the consent form. This is actually important. It isn't just like a clerical thing. They need to know for sure that when they're signing this document, that it is for your practice. And then we'll move on to the title and purpose. So you want to clearly state the purpose of the consent form, such as informed consent for medical treatment or a patient consent for procedure X. This section should explain that the patient is granting permission for specific medical treatment or procedure. So what we've been talking about is your welcome packet or your onboarding packet with a new patient. You will need to have a consent form in that packet for general treatment. So this is going to be probably like a one-page consent form, just so that the patient signs it, giving you permission to do general treatments with them. Now, if they get into the office and they need a procedure that's invasive is usually anything that breaks the skin or anything to that effect, then that's going to be considered a whole different form. That's going to be an informed consent for a specific medical treatment. Something like getting a catheter put in, maybe getting an injection of some kind. Usually with things like that, you do have to sign some kind of consent form to allow the doctor or the nurse or the practitioner to provide you with that service. And so we will talk a little bit more about that here in just a minute. So you also want to make sure that you give a place for the patient's information, their first name, last name, address, personal information, because they are signing a legal document and or a legal contract, and you need that information for it to be considered a real legal document. All right. The next thing that we are going to put on this consent form is an explanation of medical care to be received. So you're going to make sure that the treatment and or procedure is spelled out very clearly and concisely. You're going to use non-technical language, so get rid of the medical jargon. Make sure that you include information about the risks and the benefits of the treatments and any potential alternative treatments. You know, maybe they decide they don't want this particular treatment, but instead want treatment C. So you need to make sure to include those alternative treatments in your documentation. You also want to make sure that the patient understands the nature and the purpose of the treatment. Another thing to consider that some people don't think about when you have a patient signing a consent form is they have to be considered in their right mind. That means they can't be hopped up on pain medications. It means that you can't have anesthesiology come in there and start things and then, hurry up and have them sign the document. They have to be considered within their right mind. Otherwise, it's not a legal binding document. You also want to make sure to encourage your patient to ask any questions about the treatment or procedure. And then whoever the expert is, in this case, maybe anesthesia or maybe the surgeon, have them ask questions about the different, questions they might have or concerns they might have, and then have that medical professional that is the specialist be the one to describe those things to them so that they get all of their questions and concerns addressed. You also need to include a statement that is indicating that the patient consent is voluntary and that they have the right to refuse or withdraw consent at any time without jeopardizing their ongoing care. All right, another thing you need to make sure to include is risks and complications. So you need to provide a comprehensive, and that means as many as you guys know of, the risks and complications to the procedures, any complications and side effects associated with the treatment or procedure. Ensure that this information is clearly explained and easily understandable. Again, no medical jargon. It needs to be in plain English or, easily understandable language. You also want to have your alternative treatments listed. So again, maybe they don't want to choose this treatment, but they want treatment C or D. You need to make sure that that is completely spelled out in your documents so that they know what their options are. That is actually what informed consent means, is that they are making an informed decision. You also, as always, need to make sure to adhere to confidentiality and data protection. HIPAA, of course. So you want to actually outline that in this informed consent or general consent to the patient, how your facility is going to protect their information. Maybe they're coming in for a sensitive procedure and they don't want their family knowing. They have every legal right to that. So you need to make sure that that's spelled out in your documents. All right. And again, as I was stating before, this is a legal document. And so in order for it to be a legal binding document, there needs to be a patient's signature and date that indicates that they have read and understood the information provided and the consent and given the consent to the treatment or procedure. Now, in some cases, especially with the influx of some of the refugees that we've been having lately, you may need an interpreter. You may need a Spanish interpreter or, any of the other number of languages, that are represented in America. They may need that interpreter. So if that's the case, then the interpreter needs to be sign on that document. And the same with a witness. Sometimes there needs to be a witness. Maybe it's their family member that's witnessing it, or maybe it's a nurse from a different department that's coming in to sign as a witness. But somebody needs to be present during the signing to ensure that they are not, signing something that they don't understand. And then, of course, you also need to have the signature and date of the provider, saying that they are, also agreeing that things have been discussed with the patient and that they completely understand the procedure and or treatment. All right. Now, due to this being a form that you really need to sit down with your own lawyer and discuss, it's not something that I went and tried to mock up anything. This is just one I actually pulled off the internet. It's just as a representation. So this one obviously has the logo and the information of the clinic on it, and then it does exactly what we just talked about. It spells out the procedure, talks about the risks, and then on this last page here, you can see right here, there's a signature area. And you can create these in Canva, Word, Google Sheets, as long as you make sure that you talk with your lawyer and all the legal things have been covered and you're good to go with the document. All right, remember to retain a copy of the signed consent form. So when you get the consent form signed by both the practitioner and the patient, you want to run that through your copier and make sure that you retain it for your records. Because that's a legal requirement. And you also need to make sure that you're adhering to the regulations in your jurisdiction and ensuring that your consent form meets all the necessary legal requirements. All right, so we are going to remember to minimize risk and maximize productivity by documenting it, delegating it, and getting it done. Thank you for watching.